Hey everybody, this is going to be my birthing center update. This is the second time I'm recording this. Yay! um, so yeah, today I got to go to the birthing center that's about 30-40 minutes away from my house. They were having an open house. What they have you do is go to the open house first, tour the place, ask questions, and then they have you set up an appointment to actually meet with the midwife. Individually, which I did. I am seeing my midwife for the first time, or I did get to meet her today, but I will actually have a visit with her on Monday, which is super exciting. As you are all probably wondering about cost of the birthing center. This birthing center actually accepts most insurances, including Medicaid. And to my surprise, there is no extra fee or cost for the delivery because of having Medicaid, which is really surprising to me because I know that Medicaid doesn't really pay a lot for doctors. So a lot of times that's why you don't get treated the best because they're not really making any money off of you. But yeah, I was super excited about that. They do charge a small fee, less than $100, for a birthing kit, and the different testing that has to be done, for the newborn, during the delivery. Like I said, it's less than $100, and then, everything is covered. Everything else as far as the delivery goes. And, if anybody's had to pay for a delivery out of pocket, they know exactly how much it can be. So paying a little less than $100 is nothing. I definitely don't mind having to do that. The only thing is if you do have a home birth, and you live more than 10 miles away from the birthing center, they charge you an extra like 15 cents a mile, something like that, for every additional mile that they have to travel. But overall, I'd say that that's pretty good. What we did first was we went in, I watched a video. They did a video on just different birth stories, birth testimonials, why people chose to have a birth at a birthing center or at home. They do both. They do either you can have birth at the birthing center or you can have home at birth. And they bring whatever they need to your home. They have two birthing rooms. One is a little bit smaller than the other one. One is the bros room, and then they have a bigger one called the lakeside room. It's got a little lake that you can see out the window, hence the name. So they're both really nice. They're made to look like they're a room in your own home. They're meant to be as comfortable as possible. When you go in the rooms, you don't even know that that's what it is, that it's a birthing room. But they do have everything there that they need in case of an emergency. Even though it's a birthing center, they do have what they need there in case something does happen. Before they transfer you to a hospital, they will try to do as much as they can there before sending you out. Like for example, I'm sure you've all heard that Pitocin is given after the baby's born to help the uterus contract, and a lot of times it's given routinely, and they actually do offer a Pitocin shot they can give you in case they feel like you're bleeding way too much after you deliver. And also they can give you an IV, give you fluids through it. They said that a lot of moms most of the time just drink water or coconut milk, coconut water, which is probably something that I'm going to do. I want to steer away from IVs and shots as much as I can. And also, during the delivery, if you happen to tear, they will do suturing up to 2.5 degrees of a tear. So if you have anything more than that, if you have anything more severe, they do send you out. So they have everything there. But I guess I was asking a little bit more about that just because my mom, she had it with all 4 of us. She had to have an episiotomy. So first time she teared, and then they just did an episiotomy for my three sisters. But I guess what they were saying is that the midwives are pretty good about preventing the tears, and we were actually watching the video in a living room type of room. But that room can actually be turned into a third birthing room in case they need to use all three birthing rooms for some reason, which they said that that's never happened. And I guess the facility's been open since 2002. So let's hope that 2012 isn't the first time that that happens, especially not on the day that I'm there. They do offer a lot of different childbirth classes and cloth diapering classes, breastfeeding classes, and they actually take place in that living room that I was telling you about. It's cool because the lady that was doing our open house, she actually had a home birth through the midwives there, and she said that it was really neat, really educational to go through the childbirth classes, and it teaches the dads a lot too, a lot of what is happening in your pregnancy, but mainly what's going on and going to happen during the labor. And she said it was cool because at one point she started getting nauseous, and her husband could tell that she was in the transition stage. And so she just thought it was cool, you know, that he could put the two and two together and actually know what's going on with her body at the time. So, yeah, I thought that was cool too. I really hope that my hubby gets to go to these appointments. I hope that he gets to go to the childbirth classes because I feel like it would be really educational to him. I mean, he is in the medical field, but doesn't know about labor. I mean, there's a million things I don't know about labor, and I read and read and read every single day, but there's still a million things that I don't know. And I just think it would be that much better if he could go and be with other dads, see other pregnant women, see what everybody's going through, and be able to be more educated the day of. And I guess for first-time moms like myself, they really, 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 really recommend it because they want you to be able to learn the different breathing techniques, different things you can do to help with the pain of delivering. They also have a kitchen, and the kitchen is just like a little tiny kitchen back in the corner. But when the moms go into labor, what they do is they close down the birthing center. And they close down the birthing center and make it so that it turns into a home environment. And they have the like I said, they have the two birthing rooms, living room, and little kitchen. So like if you have a lot of people there, for some reason, you know, they can kind of just come and go around the house as they please, like they would in their own home. And they were saying that the dads are pretty good about cooking, and they'll cook lasagna and feed the whole team that's helping to deliver the baby. So I thought that was cool. They say they do about 7 to 8 births a month, and usually it's just 1 to 2 at the same time. Usually it's like one at the birthing center and one at home. Usually, rarely, very, very rarely will they have 2 births at the birthing center, which is awesome to me. So at the births, there's a midwife and a student midwife present. If you're having a home birth or a birth at the birthing center, and they give you the option to do the water birth if you want. If you do the water birth at home, they'll bring a tub to your home. Now, the lady that was doing our open house, she said that she had a home birth through them, and but the thing was that the tub that they brought so that she could do a water birth, it just didn't stay warm enough. She didn't get the full effects of it, she said, and she really wished that she would have had it at the birthing center because of the tub. I didn't mention this earlier, but you can eat. You know, they don't put any restrictions on what you're eating or drinking throughout your labor. When you go to a hospital, a lot of times they don't let you eat before you deliver. In case something happens, in case they have to take you in for a C-section. They don't want you to have AIDS. So they have a 10% transfer rate to hospitals, and usually it's not in an emergency situation. Usually it's because the mom is requesting an epidural, and so that's great to hear. Most of the time it's not under any kind of emergent situation. When you go in for labor, you contact your midwife, and if you're having a labor at home, you let her know, obviously, how it's progressing. But when you're about 5 minutes apart, they tell you to, your contractions are 5 minutes apart, tell you to go ahead and come to the birthing center. And you stay at the birthing center until you deliver, obviously, and then you stay there an extra 5 to 6 hours. They said that, if it's really late or whatever, it can turn into a bed and breakfast. It's pretty much, they play it by ear, but most of the time you stay at the birthing center 5 to 6 hours after you deliver, and then you go home. So what's great about having it at a birthing center is the baby stays by mommy's side at all times. As soon as the baby's born, they put the baby on mommy's chest. They strongly believe in skin to skin. They were talking about how important the first hour and a half is when it comes to bonding. And so they do all the assessments right there while mommy's holding baby, trying to breastfeed baby, whatever's going on. And then when mom says it's okay, they'll take the baby and weigh the baby. What I thought was cool also is that they do wait for the cord to stop pulsating before they cut the cord. And they also allow for the dads to deliver the babies. And so I was telling Sean about, being able to deliver the baby. And like when I first had mentioned it a while back, he was kind of like, iffy about it. But I was just telling him, like how many dads can say that they actually delivered their own baby, that you're the first person that touched that baby and was able to pull that baby up and, hold the baby. You're the very first person. I'm like, how many dads can say that they actually delivered their own baby? It's like, yeah, that's true. So I got a little bug in his ear, and I'm hoping that he goes along with it. They were saying that they will ask the dads if they want to deliver, so I'm sure when it comes down to it and they ask him if he wants to deliver the baby, I'm sure that he will say yes. And with all that said, so it's official. I'm going to deliver at the birthing center as long as baby comes after 37 weeks and before 42 weeks, because they do have a restriction. If you go into labor before 37 weeks, they don't deliver you, and if you go into labor after 42 weeks, they don't deliver you either. So that's the only thing. So hopefully, she comes within the time frame that she's supposed to. So what's really neat about this birthing center that it's more of a community. They, try to bring everybody close together. It's more like a family. And what they do is they have a 28-week and a 36-week community appointment. So you get to meet with other moms. So I'll be going to the 28-week appointment, hopefully, if I don't have to work, on Wednesday. And get to meet with other moms that are 28 weeks or close to 28 weeks. And they do their sugar test there too. But the sugar test is actually, they don't make them drink that orange drink. They make them drink like a Welch's like grape fruit juice drink. And so, and then they draw everybody's blood and send it off to the lab. But it's really neat to know that you can have other moms there that you can talk to, see how their pregnancies are going, and first midwife appointment on Monday, and it's going to be an hour and a half long. We go over medical history, get to know each other, just go over everything, and it's about an hour and a half. They also do a nutritional assessment, make sure you've been eating right. All the other appointments are going to be 30 to 45 minutes long. which is awesome compared to going to an OB where you're sitting there for waiting to see them for 30 to 45 minutes, and then you only get seen for about 5 minutes. So I just really, really awesome. And a breath of fresh air to know that I'm going to be actually treated with care, and I'm not going to just be a number. They're actually going to be able to take time to work with me, make sure I'm as healthy as I can possibly be, make sure my baby's as healthy as she can possibly be, and if everything goes well, then I'll be able to deliver with that. They do refer you to an OB if something were to happen, or if they feel like you're at high risk for whatever reason. But it's just good to know that they're not going to do that unless it's absolutely necessary. Like when it comes to the delivery, they're not going to use medical intervention unless it's absolutely necessary. Obviously, you have to get the weight, you have to make sure the baby's breathing right, temperature. You have to do all that. But as far as doing any kind of unnecessary procedures, they're not going to do that unless it's absolutely necessary, which is really, really good to know. They see you monthly, until you're 28 weeks, and then every 2 weeks, and then until you're 36 weeks, and then they see you every week until you deliver, just like if you were going to an OB. Now, if you're going to have a birth at home, they do a visit 1 month before your due date at home, which is nice. And they usually arrive when you're in active labor and your contractions are 3 to 5 minutes apart. And if you're going to be going to the birthing center, you're not having a birth at home, then they would tell you to come in at that point. And what I thought was cool is that they don't consider age a high risk factor, so they won't turn you away if you're past the age of, I think it is 30, 35, where you're considered high risk. But like I said earlier, they don't deliver if you're before 37 weeks or after 42 weeks. So, and they also don't deliver twins or triplets, which that's just my facility, but I have seen online where a lot of places will do home births, water births, births at birthing centers for twins or triplets. So I don't know about triplets, but I have seen twins and read about twins being born. But anyways, so yeah, I'm just so thrilled. I'm just so excited. I can't wait to go to the first appointment. I can't wait to go to the meet and greet. I think that's going to be awesome, being able to talk to everybody, see how their pregnancies are going, and then actually be able to go to the first OB appointment. I think that's just going to be awesome. So hopefully Dad will get to come along with me. I think he probably will, because now that I think about it, he said next week that he works Tuesday, Wednesday, Thursday, and my appointment's on Monday, so hopefully I can get him to come with me. I've already been through 2 OB doctors. The first one, I loved him. He was such a good doctor, but the thing that I didn't like is that, when it came time to deliver, he only delivered your babies if you were having a C-section or if it was going to be a difficult delivery for whatever reason. If not, he would have one of the midwives deliver you. And there was about 3 midwives, and you wouldn't know which midwife until the time of the delivery, whoever was on call. And I just didn't like that. I want to know who's going to deliver my baby. I don't want to just have whoever deliver. And like at this facility, there are a few different midwives, but it's like a community. You get to know everybody. They spend a lot of time with you. You spend a lot of time with them. You get to talk to them. I mean, it's just way different. It's not like a OB office. And I really don't mean to talk bad about OB offices. I know there's a lot of really good doctors out there, but the thing is that I think the way that it is now is just that they have so many patients and they don't have the time to give the attention that they want to give. I think that if they didn't have as many patients, they would be able to give you more time. But the truth is that it's not like that. And that's what I think is awesome about this birthing center. It's like, as much as I do want more people to go to birthing centers, or have a birth at home, then that would mean that I would have um, more people going into labor at the same time as me. But that's what I really like about this birthing center, is that they really take time with you, and I mean that's all that I've heard. So I'm just really excited. Hopefully everything works out, and baby comes when she's supposed to come, or around the time that she's supposed to come. And my experience is a pleasurable one, because I feel like I've been through many doctors, and I'm not trying to be a pain in the butt. I just want good care. And I just want somebody that's gonna genuinely care about me and genuinely care about my baby. So I'm just really excited. I'm gonna post a video tomorrow for my 27 weeks, and then if I do end up going to the community group meeting, 28-week community appointment at the birthing center, I'll post a video on that. If not, I will definitely post a video on Monday for my first. Sorry, I'm so out of breath for some reason. We'll post a video on Monday for my first initial midwife appointment, and let you guys know how it went, and everything that we went over. So if you have any questions, or want to know more about the birthing center, or have any suggestions or comments, don't be afraid to leave them. I'd be more than happy to try to answer anything that you guys want to know. So yeah, thank you for watching, and I will see you guys tomorrow, hopefully, for my 27-week update.